Hello everyone. Today I'll be taking another VivaLive session with QQSphere on the subject of embryology on the topic gametogenesis and fertilization. So let's start.
Welcome to the examination on gametogenesis and fertilization. We will be focusing on ploidy changes. To start, could you describe the ploidy of the primordial germ cells before they enter meiosis? Please note that this discussion is for assessment purposes only and does not constitute medical advice or diagnosis. You should consult a healthcare professional for any medical concerns.
The ploidy of primordial germ cells before they enter meiosis is 2n. They are they are diploid.
Excellent. Now, could you explain what happens to the ploidy of these cells during the first meiotic division?
During the first meiotic division, they change from diploid to haploid, which is 2n to n.
That's right. So, what does this mean for the chromosome number in the resulting cells, specifically in spermatogenesis?
The chromosome number goes from 46 to 23. That is, diploid has a chromosome number of 46, which undergoes meiosis and changes to 23 number of chromosome, which is haploid.
Exactly. Now, contrast this with oogenesis. When does the first meiotic division complete in the oocyte?
The first meiotic division completes in the oocyte.
You are on the right track, but when precisely does that happen relative to ovulation?
It happens during embryogenesis in a female
Actually, the
fetus.
first meiotic division in oocytes is arrested in prophase 1 before birth and is only completed just before ovulation. Now, what is the ploidy of the secondary oocyte that is released during ovulation?
The ploidy of the secondary oocyte is haploid, N.
Yes, that's right. And when does the secondary oocyte complete its second meiotic division?
Uh, the second, the secondary oocyte completes its second meiotic division right before ovulation, which is
Not
arrested in
quite. The
metaphase
second meiotic
2.
division is actually arrested in metaphase 2 and is only completed only if fertilization occurs. If fertilization does not happen, the oocyte degenerates. Now, considering fertilization, what is the total chromosome number and ploidy of the resulting zygote? It seems you might have been interrupted. Could you please proceed with your answer? What is the final chromosome number and ploidy of the zygote after fertilization?
After fertilization, the final chromosome number of the zygote comes to 46, which is diploid 2n in number.
Excellent. Now, can you tell me what maintains the diploid condition of the species from generation to generation?
The diploid condition of the species is maintained by gametogenesis, which includes first dividing the number of chromosomes into half, that is going from diploid to haploid, and then undergoing mitosis, and fertilization causes
You
the
are partially
number of
correct. Gametogenesis does reduce the chromosome number to half, creating haploid gametes. What crucial process then restores the diploid number? It's not mitosis, but something else we've discussed.
It restores the diploid number by fertilization and fusion of two haploid cells into one.
Exactly. That combination of meiosis and fertilization maintains ploidy across generations. Now, could you briefly tell me what happens if there's an error during meiosis, resulting in a gamete with an abnormal number of chromosomes?
Uh, if there is uh, if there is an error during meiosis resulting in a gamete with an abnormal number of chromosomes, there can be triploidy in the resulting zygote, which can cause genetic diseases.
That's a good point. While triploidy or having three sets of chromosomes can occur, errors more often result in situations where there's a single extra or missing chromosome, like trisomy 21. What specific term do we use for having an abnormal number of a particular chromosome?
Trisomy 21 is also called Down syndrome.
That's right. And what generic term describes the condition of having an abnormal number of chromosomes rather than naming a specific condition?
It's called trisomy.
Trisomy is a specific type. The general term for having an abnormal number of chromosomes is aneuploidy.
Aneuploidy.
What happens to the ploidy level in a cell that experiences non-disjunction during meiosis?
Uh, the ploidy number level increases in a cell in case of non-disjunction during meiosis.
Not quite correct. Non-disjunction leads to gametes with either an extra or a